The world is aging. People are living longer. This demographic shift is especially pronounced in developed nations like the United States and Japan. As the elderly population grows, so too does the need for their care. This trend presents significant emotional and financial challenges for families and societies alike. We must confront the realities of aging and find sustainable solutions for elder care. We must ask ourselves difficult questions. How do we provide affordable and high-quality care for our aging loved ones? How do cultural expectations and societal structures influence caregiving decisions? These questions are increasingly urgent. We need to understand the complexities of elder care and work towards solutions that prioritize both the well-being of the elderly and the sustainability of our healthcare systems. The challenges of elder care are not merely logistical or financial, they are deeply personal and emotional. Caring for an aging parent or relative can be physically and emotionally draining. It can strain family relationships and finances. It can also force difficult decisions about work-life balance and personal aspirations. We must acknowledge the sacrifices made by family caregivers. We must provide them with the support and resources they need. The aging of our societies is a global phenomenon. It demands our attention and action. We must work together to create a future where our elders can age with dignity, respect, and access to the care they need. Section 2. A looming demographic crisis. The United States and Japan are facing a demographic time bomb. Birth rates are declining and life expectancies are increasing. This combination creates a situation where a smaller working-age population is tasked with supporting a much larger elderly population. The numbers paint a stark picture. In the United States, the number of Americans aged 65 and older is projected to more than double by 2060. From 52 million in 2016 to 95 million. This means that nearly 1 in 4 Americans will be over the age of 65. Japan, however, is aging at an even faster rate. By 2065, it is estimated that nearly 40% of the Japanese population will be over the age of 65. This demographic shift will have profound consequences for both nations. The aging population will place significant strain on social safety nets, healthcare systems, and family structures. The aging of the population is not inherently negative. In fact, it reflects the success of our societies in extending lifespans. Longer lifespans are a testament to advancements in medicine, sanitation, and living standards. These improvements have allowed people to live healthier and longer lives. However, we must adapt to this new reality. We need to rethink how we support our aging population. We need to create societies that are equipped to support a larger elderly population both financially and socially. This means ensuring that our social safety nets are robust and that healthcare systems are prepared for increased demand. Addressing the challenges of an aging population will require a multifaceted approach. This includes not only reforming healthcare systems, but also strengthening social safety nets to provide adequate support. This includes reforming healthcare systems, strengthening social safety nets, and ensuring that elderly individuals have access to the resources they need. Promoting policies that support family caregivers is also crucial. Family members often play a key role in caring for elderly relatives, and they need support too. It also means changing our attitudes towards aging. We need to value the contributions of older adults and recognize their potential. Creating communities that are inclusive and supportive of older adults is essential. By fostering environments where older adults can thrive, we can ensure a better quality of life for everyone.
Section 3. The crushing weight on American families. The financial burden of elder care falls heavily on American families. As the population ages, more and more families find themselves grappling with the high costs associated with caring for elderly loved ones. The costs of assisted living facilities, nursing homes, and in-home care can be staggering. These expenses often come as a shock to families who are unprepared for the financial strain. A private room in a nursing home in the United States can cost over $100,000 per year. This figure can vary depending on the location and the level of care required, but it remains prohibitively expensive for many. Even assisted living facilities, which typically offer a lower level of care, can cost upwards of $50,000 annually. These costs can quickly add up, especially for families with limited financial resources. These costs can quickly deplete the savings of retirees and their families. Many older adults find themselves dipping into their retirement funds, leaving them with little to no financial security for their remaining years. Many families are forced to make difficult choices between providing for their loved ones and maintaining their own financial security. This often means sacrificing their own needs and future plans to ensure their elderly relatives receive the care they need. The emotional toll is equally significant. The stress and anxiety of managing elder care can lead to burnout and emotional exhaustion for family members. Family members often become primary caregivers, sacrificing their careers, personal lives, and emotional well-being to care for aging parents or relatives. This can lead to feelings of isolation and resentment, further compounding the emotional strain. This burden disproportionately affects women and minority communities, who are more likely to provide unpaid care for elderly family members. These groups often face additional challenges, such as lower incomes and fewer resources, making the financial and emotional strain even more pronounced. The lack of affordable and accessible elder care options in the United States creates a system where families are often left to shoulder the responsibility and financial burden alone. Without adequate support, many families struggle to provide the necessary care, leading to a cycle of stress and financial hardship that can be difficult to break.
Section 4. Japan's Insurance Safety Net. Japan, facing an even more acute aging crisis, has taken a different approach to elder care. With one of the highest life expectancies in the world, the country has a rapidly growing elderly population that requires extensive support and care. In the year 2000, Japan implemented a national long-term care insurance system, a groundbreaking initiative aimed at addressing the needs of its aging citizens. This mandatory insurance program is designed to provide financial assistance to elderly individuals who require help with daily activities. It ensures that those in need are not left without support. Under this system, all citizens over the age of 40 contribute to the long-term care insurance through a social insurance premium. This collective effort helps to create a sustainable pool of resources dedicated to elder care. Those who need assistance with daily tasks, such as bathing, dressing, or eating, can access a range of services. These services include in-home care, daycare centers, and nursing home care, ensuring comprehensive support for various needs. The long-term care insurance system has been credited with expanding access to care for elderly individuals in Japan. It has also played a crucial role in relieving some of the financial burden on families, allowing them to focus more on emotional support and less on financial stress. By providing a structured and reliable safety net, Japan's long-term care insurance system has become a model for other nations grappling with similar demographic challenges. It highlights the importance of proactive planning and community involvement in addressing the needs of an aging population. However, the system is not without its challenges. The increasing costs of care, coupled with the shrinking working-age population, have put a strain on the LTCI's financial sustainability. There are also concerns about the quality of care provided by some facilities and the long waiting lists for in-home care services. While Japan's LTCI system offers a potential model for other countries grappling with the challenges of elder care, it is clear that even a well-established system requires constant adaptation and reform to meet the evolving needs of an aging population.
Section 5. The price of progress, the cost of care. The rising costs of healthcare and long-term care are major contributors to the financial burden of elder care in both the United States and Japan. Advances in medical technology have led to longer lifespans, but have also resulted in more expensive treatments and interventions. Chronic illnesses, such as heart disease, cancer, and dementia, are more common in older adults and require ongoing medical management, often at a high cost. Furthermore, the increasing demand for healthcare professionals coupled with a shrinking workforce is driving up labor costs in the healthcare sector. These factors, combined with an aging population, are creating a perfect storm for escalating healthcare and long-term care costs. Projections indicate that these costs will continue to rise in the coming decades.
placing further strain on individuals, families, and government budgets. Addressing the rising costs of care will require a multi-pronged approach. This includes exploring innovative models of care delivery, such as telemedicine and community-based care. It also involves investing in preventative healthcare measures to reduce the incidence of chronic illnesses and promoting healthy aging.